I'm Dr. Sandal, founder of Atma Clinic. The modern medical system is falling apart. To fix it, we need to change how we think about health, illness, and the practice of medicine. Welcome to the show, Talking Shift, where we discuss radical new perspectives on health, illness, and the practice of medicine. Joining me today is Lorraine Rowe. She is a longtime practitioner and physician's assistant working in the conventional system and has now found her way more to a open-minded approach, integrating a lot of other interesting ideas. We are very, very happy to have you on the show. Welcome.
Thank you. I'm happy to be here.
So today we're talking about the limitations in the conventional medical system, something that you and I were having some chats about earlier, and it kind of occurred to myself that it would be fun to get this on camera and we can kind of jam a little bit about why people might be interested in moving into integrative medicine from the conventional medical system. Thoughts on that?
I think that the integrative system is much more complete. The traditional mainstream medicine has valid ways of caring for people, but they're not complete. They leave things out. The biggest thing that I've seen left out is nutrition. One of the most difficult things is time constraints. If you don't have enough time to allow your patient to be comfortable with you and to express to you what their concerns are and to tell you the whole story, how can you properly diagnose them?
It's definitely a lost art. There's this old saying that a doctor-patient relationship, the therapeutic relationship, and as medicine becomes run and driven more by bureaucrats and metrics and insurance coverage and all these sort of constrictions, the art and magic of medicine gets edged out. And one of the things that I think about frequently, people say, well, you know, medicine is a refined science. Why would you go into something that is more flexible or that doesn't stick as rigidly to the algorithms of modern medicine?
You need to have an open mind. And I was one of these people at one point. There are people who think modern medicine, the first word is modern. You know, it's the latest, greatest, best thing out there. But look at some of the ancient practices that have made a difference for whole civilizations. And modern medicine tends to write those off and turn a blind eye. And I think integrative medicine, in my mind, is an integration of both. Bring to the table the best of both worlds. It means learning a lot more.
Yeah.
But look at nutrition. Look how important nutrition is to us. And yet, nutrition is very, very low on the list of things that you learn in a medical education. And it's as basic as you get.
I heard something interesting recently. There was someone who was compiling data, all the recent studies on public health around nutrition. And they brought out the very, very interesting finding that most Americans are deficient in at least 6 major nutrients. And these are things like magnesium, for instance. And this person made the point, they're like, magnesium is used in hundreds of biochemical pathways. Well, what happens when we're deficient in that? Well, some of those biochemical pathways can't run efficiently. They have to wait for the next allotment of fuel to run that engine. And so this person was astutely and very interestingly pointing out, no wonder everybody's ill. If we literally can't run our basic pathways because our agricultural processes aren't allowing us to get the nutrition we need, we literally don't have the ingredients to run the machine, if you will.
Exactly.
And here we are, many orders of effect later, trying to go, well, you know, what if we give you this pharmaceutical to modify this receptor to help constrict the blood vessels, to change your blood pressure? when really all we needed was potassium. And in fact, there's plenty of very interesting data showing that a deficiency, a mild, a subclinical deficiency of potassium, is at the root of many people's elevating blood pressure.
Another interesting fact that I have learned about nutrition is more and more people now in this country are being diagnosed with celiac disease. And at a much later age. Not necessarily as babies or toddlers, which is what was happening originally back in the 40s, I believe.
Right, yes.
And there's been a lot of speculation about genetically modified wheat.
Right, yeah.
And
something's causing the change.
All the things that have been modified in wheat to make it produce more wheat so we can feed more people.
It's more efficient.
And yes, much more efficient. And this is true. They've made all these wonderful changes. But they only look for the change that they want, and they don't do the research to show that it does not have other negative
Well, and that's
actions.
Hugely analogous to the modern medical system. It is very reductionist as opposed to integrative. The idea being that they're thinking only about some very particular markers. And there's a risk then of losing the big picture. I read something really interesting, not related to human medicine, but very interesting. There's been a rash of diabetes in bears at zoos.
Oh, really?
And there's been this big conundrum. I'm like, well, what is causing this? What's going on? And all the zookeepers are like, yeah, well, we're feeding the bears their native diet. All of a sudden, what's happening? Why is this occurring? And they found out, after much hubbubaloo, that what was going on is that the apples and other fruits that they were feeding the bears have been overbred for sugar content. Exactly like you're talking about with the wheat.
Make it sweeter.
Yeah, which, makes sense if we think about, what is the value of an apple? Well, it's the calories. But that's not the reality. That's the sort of modern
That's
reductionist.
The tunnel vision.
Yeah, exactly right. And there's this whole orchestra in nature of these minerals and phytonutrients in the apple that accidentally gets bred out in exchange to make them little sugar balls. And it's not healthy for the bears in an extreme fashion. We're not dissimilar. Our nutrition, our whole system of agriculture has been wired for efficiency, but you're exactly right, that efficiency has a tunnel vision. And so then people end up with all of these sort of morbidities, all these troubles, simply because they're not fueling the engine the right way. So then we have to get out of the sort of mechanistic or algorithmic or simplified version of medicine that mainstream medicine presents and go back to the drawing board. And that's what I see integrative medicine is. It's medicine going back to the drawing board. I frequently say at Atma Clinic, our job is to reinvent healthcare.
And I like that idea because it's health care. A patient comes to you because there's a problem with his health. So you diagnose the problem with his health, and mainstream medicine says, okay, here's your prescription, take this to your pharmacy. This should help. But why does he have that problem? What is the cause? Get to the bottom of the mystery.
That's a really big deal.
And if you treat the cause, then you don't need these expensive pharmaceuticals that are going to do who knows what else to you.
Right. And it's kind of amazing how much of a revelation your statement is. So many people think that medicine has the situation under control, right? Even a lot of doctors, they've stopped calling it a practice. Right, in the old-time doctors, like, I have a practice. Like, well, doc, why do you call it that? Because I'm always getting better. We're always learning. And a lot of doctors, I believe, have kind of come to buy into the delusion that our science is a finished product. And that, frankly, is an intellectual, I'm going to say laziness, not out of disrespect to the physicians, but out of disrespect to the system that makes it hard for physicians to have intellectual curiosity.
Yes.
when they're constricted by insurance and by the bureaucrats, and the list goes on and on and on and on, 15-minute visits, heck, 10-minute visits sometimes, heck, 5-minute visits sometimes. It's very hard for physicians to pull out and see the big picture and kind of go, okay, well, for Neela, he's unique in this fashion, and his diet is a little bit limited here, and he's got these strange variables. Okay, the big picture is this. And in doing that, they can come around to actually solving the problem or answering the question of, well, why did Neela develop that disease?
Yeah.
The pharmaceuticals work. They work to manage the disease, but rarely are pharmaceuticals created with the intention of resolving a disease, because that's more complex. Getting to that is unique to me. Why does Neela have, let's say, high blood pressure? Well, there are unique reasons for that individual that we have to figure out. And you can't really do that in 10 minutes.
No, you can't.
We find ourselves in a fascinating situation. For some reason or another, a lot of times this week, people have been asking me, Doc, why don't more people come over to this sort of medicine? Or why is it hard to convince people that this sort of medicine has value? And I kind of pause, and I'm like, that's a hard thing to answer. We have a culture that puts medicine and physicians up on a pedestal. People want to believe that they have it under control, that someone else has it under control. That way they don't have to worry about it. And I get that. But the reality is that doctors are all practicing, and our science needs to continue to evolve. And individuals have to advocate for themselves in that process. They have to demand good health care, firstly. Hey doc, in 10 minutes we're not going to solve this problem. Right? That's a good line, right? But it's hard to get physicians to practice their art now. They're very much in the mode of algorithms, and this is why there's part of a debate about, MDs are getting replaced by nurse practitioners and physician assistants, and soon it'll be nurse practitioners and physician assistants are getting replaced by AI. In algorithmic medicine, we can simplify. But from your practice as a physician assistant that good medicine is never algorithmic.
Never.
It's
never
part of it.
You can't do anything without a really, truly good patient history.
Yeah, right.
And
the devil's in the details.
And that is sometimes very difficult to get.
Yeah.
And it's not something that's going to happen in 20 minutes.
You're right. Right.
I think of a patient that I took care of when I was practicing in infectious disease, and he came in from western Kansas, and he was convinced that he had some sort of cancer.
Interesting.
And he was miserable, and he was losing weight, and he was becoming weaker, and he was having trouble breathing, and I was new. So my supervising physician was very involved, and so we went through this together, and one of the questions on the patient history was, where do you live and what do you do for a living? Well, he lived in western Kansas, and he had been a farmer, but he just said retired.
Okay.
So we had to say, retired from what? Farming. Have you lived anywhere else? Oh yeah, he had lived in, I believe it was the Four Corners area for a long time. This gentleman had, he had a fungal disease in his lungs.
Yeah, endemic to the Four Corners, huh?
Yes, and when we treated that, he got remarkably better. He was like a totally different person.
That's awesome.
So yes,
it took
traditional modern medicine has its place. It definitely has its place, but it requires time, not just an algorithm.
Yes, absolutely. And I think most older physicians pine for the way that things used to be. Because doctors are all sweet, compassionate, intelligent people.
Yes.
You know, that includes nurse practitioners and physician assistants. Everybody who gets into this business, they come to do good.
They want to help.
Yeah. And they're scientists. They're curious. They want to do all of that work. And unfortunately, we have now a system that simply doesn't allow that. The system, with all of its many financial constraints, insurance approvals, prior authorizations, time limitations, the bureaucrats knocking on the door at 5 minutes saying, "Doc, you have 5 minutes left," and we're going,
I'm only at question number 3.
When doctors get in that situation, they can't engage in the art of medicine. And I really think of integrative medicine as getting back to the art form of medicine. How do we progress the science? Progressive science does take a type of artistic inspiration. It's not mechanistic. It's not algorithmatizable.
No.
It's something that comes from human ingenuity.
Yeah,
and it takes time.
You look at the you look at this patient and you look at what the problem is, and you just have to think about it in a creative manner.
Right. I love the word creative. It's a type of meditative effort. It's like, what am I missing? What am I missing?
If this does this, then if A does B, then how did we get to D? Where's C? What's going on in here?
And to go back to your earlier point, that was very astutely made, all of that should be in service to the real question, which is, where did this illness come from? I see patients every day who have cancer, for instance, and very rarely, very, very, very rarely do oncologists ask people, where did this come from? Or give them an answer to that question. And every single patient wants to know that. Now, there's a lot that oncologists do that is wonderful for chemotherapy and support and these things. But what happened to the central question? Because let's assume that we get someone through a cancer and they go, oh, great, wonderful. Again, they're going to go, how do I stop that from happening again? And as a society, we've lost some curiosity. We should ask, why did the diabetes happen? Why did cancer happen? Why did someone have elevated blood pressure? All of those chronic medical illnesses, they have foundational roots. There is some root to that gnarly thistle that grew. And, you know, we can lop the head off the thistle. Keeps on coming.
It's still going to keep coming back.
And that's what I get really excited about, and why I think patients keep on coming and patronizing physicians like myself and people who are open-minded like yourself. How do we advance medicine? Let's not be stuck. Let's push the science of medicine further forward. I just get lit up about that. I love that. And unfortunately, you know, what do we have to shift in our society? We have to shift a lot of things about mainstream medicine if we're going to have good healthcare again. We really have to reinvent healthcare.
Yes.
Because now things are all bound up in a ton of different interlocking ways. I think of mainstream medicine as a sinking ship.
Yes.
You know, there's a bunch of people running around on deck trying to, you know, patch holes, and new holes keep on showing up. And at some point, that whole system is just going to collapse in on itself. I really am starting to suspect that that's a reality. And I think a lot of doctors feel the same way. And I think a lot of patients more so feel that way. They go, I don't think I'm going to go to the doctor. Because they know that it's not getting to the root of their health. It's not health care, it's illness management.
It'll put a Band-Aid on the problem.
Which is
maybe
good.
But it's not going to get to the bottom of the problem.
Yeah. And when we think about our healthcare system, you know, one of the reasons the ship is struggling so much is because it keeps on being buried under its financial pressure. You know, for instance, people think about the cost of healthcare in the U.S. Why is that so extreme compared to our European neighbors, for instance? And a big part of that, of course, is that if we keep on stacking bandages on problems and new problems keep on coming up, well, we never reduce costs. We never fix the dang thing.
We only increase them.
Yeah.
And I think something that is difficult for people is in today's world, in this country, in our culture, they want the bureaucracy to cover them for everything. And
it's someone else's job.
And the expense is real.
Yeah, right.
But we choose how we are going to use our funds.
Right, right.
We make choices. And sometimes we have to make hard choices.
Uh-huh.
But do you want to get better?
Uh-huh.
Do you want... I would rather add quality to my life than to add years to my life. If it's years of misery and suffering,
Right.
then just let me go.
Right.
But if I can make some basic changes in my life that are going to make it better,
Right.
I'm all for that, and I am willing to invest in that. It isn't just an expense, it is an investment. And
Of time as well.
yes,
Yeah.
and people need to understand that it is in part their responsibility to invest in themselves. It is also, it's their choice, it's their option, and we're very fortunate to have the choice.
I'm keen to see people continue to vote with their wallets, right? You know, ultimately that's what drives change in our society. That's at the end of the line. That's what is going to drive change. And there are so many obscured costs. To your point, you know, where do I choose to spend my money? There's so many obscured costs in our modern medical system. Everyone pays into it. It goes into some slush fund. That slush fund gets distributed to a bunch of doctors who don't have a really strong incentive to do excellent care, nor do they have a system in which they're allowed to do that, right? Even when they want to do that. And, you know, as an MD, I can't ethically treat my patients without having their best interests at heart. And that takes time, and that takes attention. And so we have to design a separate system that allows that. And that's what I'm very pleased at having work here at Atma Clinic. I feel like we have a system that gives great freaking health care. And that shows in our results. And as a physician, that's what I came for. You know, that's why I went to med school and took the Hippocratic Oath to really make a change. And now it's so curious because it's not easy to make a change, because it's become this sort of political, cultural, bureaucratic. There are lots of doctors out there who I think feel the same way that I do, and also they go, how do I do this?
Yeah.
Oh God, let me just...
It's just such a daunting undertaking.
52% of physicians are aggressively burned out. They hate their work.
Yeah. And to me, that's heartbreaking.
It is. It's horrible. All these sweet people who came to use their brains to heal people. And they don't want to go to work. Something's not happening right. And that ship is just gradually sinking.
And their patients know it.
Yeah, right. Totally. And how do we encourage people, Lorraine, in your mind, how do we encourage people to take that seriously? In my mind, part of that has to be that there's a lot of poor quality control on our side of medicine. It's true, you know, there are practitioners who aren't worth a darn.
Yeah.
And that kind of poisons the well. It's like...
And I think there's a lot of just ignorance. I don't think people understand what integrative medicine is, what that means.
Right, I think you're spot on.
And I'm not sure what the best method is to get the word out.
This is part of the reason we started these podcasts on our YouTube, was to basically, we had played for a long time with marketing.
Okay.
And the sort of like, hey, let's run an ad in a magazine, or, you know, let's put an ad up on Google or something. And what we came to realize is that this is too complicated of a discussion to have in a short form. It takes education, it takes conversation, it takes, I didn't realize that was a real thing, right? It takes that sort of epiphany moment. And so I love having these conversations because people go, okay, I'm starting to get it, I think.
I mean, you can depend on word of mouth, because word of mouth is valuable. And I certainly have shared with acquaintances and friends of ours about our experience here. So shortly after our first visit with you, we came back for a second visit. And at the end of that visit, I have told other people I could have wept with gratitude and with relief that all of the details for what he needs, I didn't feel like I had to shoulder that responsibility on my own, because no one in mainstream medicine was looking at these other outlying things. And I know enough to know they can have an impact, but I don't know where to go with them. So that's where some of my gratitude was coming from, and my relief. And that you are open to listening and to looking at the whole picture, not just this one little piece, but look at the whole picture.
I always find onboarding patients, one of my favorite things is to paint that big picture of their health. You know, there's that zoom out. It's like, okay, we've played Sherlock Holmes. We've done that really good history. We have a sense of all of the different pieces of play. We know what mainstream medicine has done. We know, therefore, what they've missed. What's fallen between the cracks on that. And all of that becomes one big question about an individual's health. And then we want to put forward an integrative plan for that. And that type of organizing and careful consideration, I hope, is deeply empowering to patients. That's a lot of what I think is missing from our medical system. Our medical system accidentally, I believe, is disempowering to patients.
Yes.
And people are smart, people are savvy, they want to be empowered, they want to know how they can help their health. I have a suspicion, and this is purely speculation, so people have to forgive me if I'm off my rocker on this one, but I have a suspicion that as the business of medicine developed, there was a type of marketing that happened where there was this idea that doctors had some secret, sacred knowledge that you had to come to them for, and you can't figure it out as an individual. There was an intentional disempowerment.
Yes.
You can't hear your body. You have to go to the priest to hear the body, right? And the priest in this scenario is the physician. And I get it. You know, business is business, and people are trying to figure out how to encourage healthfulness and these sort of things. But I think that goes too far. Now we don't have a culture of people feeling capable of caring for themselves. That sort of education is, heck, even frowned upon. I think people often have the experience of going to a doctor and they're like, hey doc, I was doing some research, and the doc goes, oh no, not this again. We should applaud that.
Yes.
Right? And we should give people really good sources for that. And
reinforce their desire to educate themselves.
Right.
By educating them on what are reliable resources. What resources are sketchy at best.
Yeah. And there's plenty of those out there
Yes.
too, which is part of the difficulty, you know, because patients, I do sometimes have patients who have come to me who have been with other alternative practitioners.
Okay.
And don't get me wrong, there are amazing acupuncturists, and there are amazing chiropractors, and there are amazing naturopaths. And also, because it's kind of unregulated, there's also versions of all of those that don't do a good job, that are frankly a waste or sometimes even dangerous. That I've seen that happen. And as we promote this culture of bigger picture healthcare, I want all those guys to be encouraged and to push, and for their training organizations to discipline and craft and shape and compel into, you know, betterness, all of that.
So that they all work together.
Yeah.
Integratively.
Yeah, exactly right. And the bottom line is that just gives good healthcare, right? That's why I think of integrative medicine as the future of healthcare. It's almost definitional. We want to advance the science, and we can take traditional Chinese medicine and Ayurveda, and we can take all of these and integrate them with mainstream medicine. I think probably one of the biggest hurdles is that people think that alternative medicine is against mainstream medicine. No. These things need to be wedded.
I think when you say alternative medicine, people get the idea, okay, you can have this, or as an alternative,
right.
you can have this. No, I want both. I want East to meet West, and everything in between, and North and South. Don't leave anybody out.
Yeah.
Take the best of what every component has to offer.
We want to do great healthcare. Why wouldn't we take the best out of everything? And the only, I think, answer on the mainstream side is, well, we just don't have the time to do it all.
Yeah.
And that's a system problem. That's not because doctors aren't wonderful, intelligent people. It's because they're in a system that isn't working. They're on a ship that's sinking.
And with all the restrictions that come along to them.
Yeah. And those are only getting tighter. You talk to any doctor off the cuff, not on a patient appointment, and they'll go, oh, yeah, it's getting, I'm getting leaned on more and more and more. It's harder to do the treatments that I want. It's harder to spend the time with my patients that I need.
This patient needs this test, but I can't order it because it's not going to be covered.
Yep. And then, unfortunately, going back to your earlier statement about the sort of complexity of the payments, we used to be able to just, let's say, get that MRI for a reasonable fee. But now the MRI costs way too much because of all the obscured costs that people pay into the system that comes back around. And it's so impressively complicated. That ship is crumbling under its own weight, is what's happening.
Yes.
And, early on in my career, it's like, well, can we salvage that? And increasingly I'm going, I don't really know if it's
salvageable.
Worth it. It's good to just go parallel. Let's just work in a parallel system. Let's go to cash practices that are scientific and validated, that bring in bigger options, that give more opportunity for patients to be empowered, and let people vote with their wallets. Save money on insurance and spend it on real health care.
Because insurance is not cheap.
Right. Well, and I think people don't realize that there are alternatives to insurance, right? People are like, oh, I need insurance just in case
there
a tree
are
falls
co-ops
on me.
and...
It's like, yeah, you need catastrophic, but there are cheap catastrophics that put a lot of money into your wallet.
Yeah.
So you can go and get better health care for net less than you would pay just for your silly insurance.
And have far less to worry about that you're going to need catastrophic insurance because you're taking better care of your health.
That's a great point. Yeah. Well, Lorraine, I feel like we live in exciting times. We have this opportunity to push things forward, to do great good. And I always love having the conversation.
To make the world a better place.
Yeah. Not only do we dream of such a thing, we work day in and day out on it.
Yes, we do.
Lorraine, thank you very much for everything you do, and thank you for joining us.
Thank you. It's been fun.
A pleasure.